Welcome to Boston Children's Answers. I'm your host, Dr. Jennifer Arnold. As a mom and a doctor, I'm passionate about helping kids stay healthy and happy. So join me as I chat with other Boston Children's experts to find answers for you and your family. Hi, everyone, and welcome back to the show. In today's episode, we're talking about nutrition, and specifically going to focus on healthy eating for our kids and our teens. Let's get started with today's parent question.
Hi, my name's Amanda. So I have 3 kids and they all eat very differently. My youngest is a very plain eater and basically lives on pasta with butter. My next oldest is an athlete and he eats everything as fast as I can buy it. And my oldest, I don't think she's eating enough. How do I help get them all on the right track?
Oh, Amanda, I feel your pain. I think for all of us, from the time our kids are newborns all the way into teenagers, we're worried about helping them to have healthy diets and to have good nutrition. Whether it's thinking about, as my kids were babies, breast milk versus formula, or all the way into teenagers, worrying about them having too many fast food dinners. This is a challenge. Well, luckily for all of us today, we have an expert here in nutrition to help give us tips and educate us on how to have a healthier diet for our kids. Please join me today with Carolina Ruiz. She's a clinical nutrition specialist here at Boston Children's Hospital. Thank you so much for joining us today, Carolina.
Thank you for inviting me this morning. Happy to be here.
Okay, well, I have a lot of questions for you because I am definitely not the best at nutrition. However, before we get started, tell me how you got into your specialty.
Okay, so it's a very good question. So I feel like nutrition in general really captured my attention because of the way that we can prevent disease later in life. And I feel like pediatrics is exactly the population where we can really work around that in order to those preventions.
Yeah, nutrition affects us all, no matter what our medical condition might be.
Exactly. We can really make big improvements throughout nutrition before medicine and other interventions sometimes.
That's really great. Carolina, so you are a licensed dietitian nutritionist, which essentially is, to me, a really important key piece about, your career and your approach. Can you tell me, and for our audience, what it means to be a licensed nutritionist?
So the difference between nutritionist and a licensed nutritionist is that we have the knowledge and the training, and we need to renew this training every 5 years. So to make sure that our patients has the best information all the time.
So I think that's reassuring to me to know that we have licensed nutritionists. You're at the top of your game. You're up to date with all of the latest and most important aspects of how to, be healthy when it comes to our nutrition. And so I'm really excited to chat with you today because it's just, it's good to talk to experts in the field and really get the right information.
Thank you.
I think about my work in neonatology, and we work with licensed nutritionists, even for babies in the NICU, helping us with their feedings and optimal nutrition. And then we provide nutritionists all throughout the hospital and in different subspecialties.
We are a big team that you can always count on.
It's great. It's really great. All right, well, let's dive into the topic for our parents. I think many of us hear that our kids are probably not getting a healthy diet. What are the statistics, the numbers around nutrition in our kids today?
Diet in United States is not it's as healthy as we wish in general. Fewer than 10% of adolescents really eats enough fruits and vegetables, which should be at least half of the plate that we are serving. And also, there is a lot of sodium and extra sugar in everything. So we consume very, very high amounts of sugar and sodium in our diets.
Oh, that doesn't surprise me. I'm sure I'm guilty of that, and I worry about my kids. They tend to like a lot of the processed foods, that have high amounts of salt and sodium and sugar. It's hard as a parent. Why do people not tend to eat a healthier diet?
In general, I think there is a lot of misinformation out there. the brands really make a great job on marketing, letting you believe that we are healthy, but also there is a lot of lack of access to healthy eating. And it's so much more easy just to heat it up a bag of ramen noodles than to actually get fruits and vegetables. So I think those will be the main reasons.
For my family, I know, I mean, it's the time factor that is probably the number one cause of why we don't, sort of make fresh meals and try to make sure we have that healthier ingredients. It's really hard. But of course, it's really important, right? And so when families or kids don't eat a better balanced diet or eat too many unhealthy foods, what are some of the risks to our health that can happen from that?
So there are many risks, but the chronic disease are the most related to unhealthy diet. So hypertension, diabetes, heart disease, even Alzheimer. They are starting to call it also like very related. We really need to focus on how we can improve this diet. And getting to that point that you were saying, many times it's the lack of time that we have. This is our work to help you and to teach our patients that actually we can reverse that situation, and there is many ways that we can make it more easy.
So you're telling me there's still hope,
Yeah,
right?
yeah, absolutely.
Okay, good. Well, thank goodness you're here to help us with that journey to be healthier in our eating. Tell me, from your perspective, what is healthy eating? What does that look like?
Okay, I love that question because when people eat around me, they think that I'm the food police, and eating healthy is being able to eat about everything, right? And that actually gives room for sweets or little treats once in a while, right?
Okay.
So it's about balance, it's about variety. And when we explain that, I really like to use the My Plate graphic. I don't know if you have seen it, but it's like a round that it has a quarter of that round is covered by protein, a quarter of the round is covered with grains, and half of the plate is fruits and vegetables. So this is something that I really stress out to my patients. The main character of the movie Eating Healthy is fruits and vegetables. So we really need to encourage and to focus on that balance in terms of variety, and portion size is very important.
So just to recap, half of your food plate should be fruits and vegetables, a quarter grains, and a quarter protein.
Yeah, that's ideal, and also we don't tend to mix fruits and vegetables, right? So it's kind of like an ideal word, but I always do like half of the plate vegetables, so even harder, and then a real fruit on the side.
So like even when I do cook a good meal, I could sort of look at my plate even in terms of how I serve the food to make sure that we've got half of it vegetables.
Exactly. My plate is a very good way to explain what is healthy eating, but I like to always explain as well glycemic index to kind of like make sense.
It sounds like that's something that's really important for parents to be aware of. Can you tell us a little bit about what that is?
Absolutely. So the glycemic index is how our meal is going to turn into blood sugar into your bloodstream. Okay, so we are just like cars. We need energy to function, right? So we really need to charge our bodies, our cars, and so the energy that we get to go along on the day, we get it from the food. So every time that you eat something, you will chew it, you swallow it, and it will hit your stomach. So that is where everything happens between your stomach and the first part of your intestine. But now we will focus on the stomach, okay? So then your stomach work is to disassemble this food. So it will dissolve this food.
Break it down.
And so that will be converted into this energy. I like to call it energy, but it's also the glycemic index, right? So when we eat carbs, the problem is that our stomach doesn't have that much of a work to do. So it really like dissolves very quick. It turns into this energy very quick. So instead of like having like a flow, like a constant flow, we have like kind of like a tsunami of sugar
like we hit the gas.
Body. Exactly. We hit the gas, exactly. But because that is not healthy, insulin will come and will grab all this excess of energy and will put it away in your fat cells. And so you will have like a crash down, like a very fast crash down. And then your body's lacking energy again. So it will send you this message like, hey, go and get something. We need something sweet here. So that's why we want to avoid to have big loads of carbs. But if we mix this with vegetables and fruits, which has a lot of fiber, so fiber doesn't get absorbed by your bloodstream, so it kind of like act as a net that doesn't let the sugar or like the energy to go that
like it slows it down.
Exactly, slow it down.
It's like slowly putting your foot on the pedal, right? Like
absolutely. I love how you're doing this analogy with the car. I love it. I'll add it to my visit actually.
Glad I could help.
And so that's why we really encourage fruits and vegetables. It really helps. Besides all the benefit that has a lot of vitamins, minerals, all those little things that you need for your body to work and function in a proper manner. So and then it's protein, which is very difficult for your stomach to disassemble. So proteins and fats. And here I always like to make the distinction of let's focus on healthy fats though, like avocados, olive oil, like all those fats that you find in fishes. So those type of fats are very welcome because your body really takes time to disassemble it. So it kind of keeps your stomach full for longer, so you have this feeling of like I'm doing okay, and also your body's getting this energy, this release of energy little by little, so you feel like I'm good, I'm with energy, I'm focused, and all that feeling of I'm feeling well.
So that's the healthy fats, protein, and then as you said, like for the vegetables and the fruits, they create that fiber net that helps to also keep it a slow input of blood sugar or energy.
And I would like to highlight here that I'm not putting carbs as a bad actor, right? It's just that we need to measure the amount. They play an important role in our nutrition. They are like a quarter of our plate, so they have their place in there, right? So because sometimes my patients are like, oh, last night I ate rice and I feel so bad. It's like it's nothing wrong with eating rice, right? Yes. It's more about like the balance, and so how we create this environment in our stomach.
I feel like, growing up, I knew that fruits and vegetables were important, and just, to limit your carbohydrates, and you try to avoid the bad fats. Like, all of that is information, but the way you just described it and the proportions and what they do in your body just kind of helps it stick for me. So I imagine it really helps your patients really understand how to approach a healthier diet and why that's important.
Yeah, absolutely. I feel like when you understand what is going on for real, instead of someone telling you like, eat your fruits and vegetables, and why?
Yeah.
Just because I say so, that doesn't work, right? So it's important. I really feel like it's important to have more knowledge about what is happening in our bodies when we eat, and especially because in some ways we are what we eat. So if we eat healthy, we should thrive healthy, right?
Yeah.
So yeah.
We feel better. So how does one go about eating based on the glycemic index?
I love your question. So ideally, for example, if you're having breakfast, let's say if you're eating eggs and a toast and a fruit, that it's already kind of like you're covering all the portion size and also like the variety, right? Or you can have like a yogurt parfait with fruits and some good cereal that has a lot of fiber, and that will be kind of like a balanced and healthy meal. What is your typical breakfast? So this is my work. So whatever you're doing, I can help you to improve it a little at least.
That would be great. So my typical breakfast, when I eat breakfast, although I should more than I do, is either, if we have yogurt, I'll have a yogurt, but there's only limited types of yogurt that I like. So if I'm out of my favorite, then I just skip it. So it's either just a thing of yogurt. Typically, it's a chocolate and vanilla yogurt. And then, or maybe I have like a breakfast burrito or a Oh gosh, this is the worst part, like a blueberry scone.
Who doesn't love blueberry scone, right? So I don't think it's that bad. So this is the thing, like your yogurt, if we choose, for example, like a Greek yogurt, will be higher in protein. So that will you be increasing your protein intake.
Okay.
And then if you toast some like strawberries, that's like protein and fiber already.
Okay.
So that will be better
That would be
than
better.
just the regular yogurt, right?
By itself.
It doesn't matter the flavor. Like it's more about like how is this as a whole, right?
Okay.
And then you mentioned your burrito. So your burrito, I guess it has
Beans.
scrambled eggs,
Beans or
so
eggs. Yeah, I usually like
perfect.
vegetarian.
And your tortilla is your grain. So
Yeah.
so go for it. Like
Okay.
nothing wrong with it. Yeah, absolutely. And so people tend to think that they eat worse than they actually eat, and maybe just making some little changes, we can make great changes on the long term.
Okay, so, thinking about my breakfast as our example, like when I think about the yogurt that I like, is there anything I should be looking for in terms of ingredients? Maybe one is better than the other because of the what's in the actual type of yogurt.
Reading the food label, it's a very good tool that you can have in your pocket and to really use it every day when you go to the grocery store. And I will always pay attention for yogurts, for example, to look for something that has more protein. And some things are healthy in their natural way, but they tend to add extra things. So I will also encourage to look for yogurts that has less than 6 or 4 grams of sugar.
Okay.
That will be kind of like a good combo for your new yogurt.
My new yogurt breakfast. I'm going to be looking at that label because I have to admit I haven't really looked, and I could be, eating a yogurt that I think is good because it's got protein, but it may have a tremendous amount of sugar, which is not going to help.
Exactly. And I feel like it's also important because it's not on the front of the label, on the package, I'm sorry. It's more on the real label, the information, and the nutritional information. So many times we can find a lot of cereals that say healthy grains, helping the heart, and all those things that sounds beautiful, but then when we look at the label, they have no fiber and they have a lot of sugar. So it's important to kind of like understand a little what that food label means.
That makes sense. So really being thoughtful about looking at that. Well, and then even talking about the carbohydrate piece, right? I know not all carbohydrates are the same. Potato chips is not the same as, maybe a whole grain brown rice or something like that. So can you help us to understand, what we should be looking for in the types of carbohydrates that we eat?
Absolutely. So the thing about carbohydrates it's a little tricky, I feel, because I don't wanna put rice or other grains like pasta in a bad way. They usually don't have that much of a fiber. But we can complement this if we are eating the right portion. We can complement this with the fruits and the vegetables. If we're making this as a part of the meal, it will change the way that will behave in the stomach. Okay. That being said, there is of course there is a difference between chips and rice or brown rice, for example. So definitely chips and everything that it's over processed. And what I mean by over processed is a machine already took that food, disassemble it 100 times, put it away, put it back, add a lot of new things. So it's not like food. So what happened with that type of carbohydrates is that when they hit my stomach does nothing to do. Everything did it a machine early in another stage. It turns into blood sugar very quick. And interesting, because we don't associate chips with high blood sugar. We tend to think about sweets and high blood sugar, right?
Yeah.
So anything that will be dissolved quick in your stomach, it will dissolve. It will turn into sugar very quick. So I give this tip to my patients. So put it in your mouth, close your mouth, don't move your teeth, wait for it. And if it dissolves in your mouth, it will dissolve even faster in your stomach.
Quick.
Yeah, exactly.
No work for your stomach to do.
Exactly. And your stomach, you have acidic environment. You have the movement. So you have more action than in your mouth. So if it dissolves here quick, let it pass.
Okay. Don't eat too much of it.
Yes.
So what about fats? What are the good and what are the bad types of fat in our diet?
So in general, the fats that are from protein, animal protein, but the fish, it will be the unhealthy ones. All those will be the saturated fats. So red meats. I'm not saying that do not eat red meats. I'm saying like choose the lean cuts and all that. But the healthy, let's focus on positive. So the healthy will be the unsaturated, the polyunsaturated, those that we found on avocados, like plants, seeds, nuts, the fish as well, olive oil. So those oils that comes from plant sources, that will be the healthy ones.
Excellent. I love fish, so that's a good sign. So this is really helpful for me to think about, and hopefully our audience is sort of learning how we think about protein, fruits and vegetables, carbohydrates, and even some fats. What about snacks? Because I guess I will tell you, Carolina, I am a guilty snacker. So as a neonatologist, right, we talk about babies needing to eat every 3 hours. That's me. I need to eat something every 3 hours. And like I said, when I skip breakfast, I usually pay for it because my body's like, what in the world are you doing? Exactly. And I get hangry. So I'm curious, for those of us that do like to snack, how can we do that healthily?
Yeah. And so snacks are a must because it's a simple way to really keep your blood sugar level stable, keep your body happy, and with energy along the day.
So it's a good thing.
It's a very good thing.
Okay.
But snack means between meals, one snack. It doesn't mean grace. We call grace when you are kind of like snacking. So
okay.
A snack is good, and we actually encourage those.
Okay.
Especially for children. So ideally we should be eating every 3 hours.
Okay.
And so if you're having breakfast at 8 a.m. and then you're having lunch at 12, maybe you don't need a snack, but maybe you're hungry, you can have a snack around 10:30.
Okay.
And what is a healthy snack? So we base it on, again, this idea of protein, because it's the most difficult thing to disassemble, so it will keep you full for longer, and also fiber. And you know why now.
Now right? I know why. It's a net. I think of fiber and I think net.
I love it. So kind of like that idea. So and usually when I see my patients, they are buying a lot of packed snacks, like cookies, crackers, juices. So I really encourage them to switch to something more simple, as a fruit and a piece of cheese, or like a Greek yogurt and a fruit, or like a ham and cheese sandwich and some lettuce on it. Why not, right? Kind of like doing something simple, quick, but it will be something that we will really nourish our kids.
Okay, so thinking about that healthy snack is really important.
Yeah, it is.
What about for kids that are really active? How do we keep them fueled?
So I will say that it's almost the same. They will be a little more hungry naturally, so they will have maybe instead of one cheese string, they will have two, but it's kind of like the same. If they're being active, I will also very encourage hydration, so water. And water is the best hydration. I have heard a lot of people that is drinking these energy drinks or sport drinks.
Yes.
And usually those are very high in sugar as well. So yeah, let's keep into the water. Let's stick to water. Yeah.
Any hints for the kids that don't like water? My kids aren't too bad about water, but they obviously prefer things with sugar. So any hints to make water more appealing that parents could try?
Sure. So you can actually add some fruit to the water, so the fruit will be there. I wouldn't go to juices itself, but sometimes if you have juice, you can water down your juice.
So when they have juice,
exactly. And also if you really encourage water, they will like water. It's something that once you get into the water thing, you really feel the difference on how you really get hydrated. When people drink sweet beverage, they and consciously they start thinking about it, they realize that they want to drink more and more and more of that. It's kind of making them even more thirsty than they were before.
Interesting. Okay. All right. I'm sure we all could have a little more water in our lives.
And it's about balance. Like if you are going to have some juice once in a while, it's nothing wrong with it. If you want to have a cracker once in a while, that's nothing wrong. But let's make sure, so we eat, as we were explaining at the beginning, to get the energy and to thrive throughout the day and to live healthy lives, etc. Right? So if we actually think about food as the element that will give us all that, like the energy and everything, and our vitamins and minerals and everything, and we can have some treats once in a while. And when you get your treat, please eat it without guiltiness. Just enjoy it.
Enjoy it.
Because that's another thing. Like people will eat something and it will be like, oh, this is so bad. No, just enjoy it. If you made the decision to do it, just do it and enjoy it. Yeah,
I like that philosophy. So Carolina, let's bring it back to our question from our parent Amanda. She has one child that she's worried because the child's an athlete, that maybe they are eating more or need to eat more, and then another child that's a picky eater and is worried that maybe is not eating enough. How do you advise parents for appropriate portion size, and sort of how to determine the adequate portion size based on activity level?
Mm-hmm. So as you mentioned, it will depend on the age. Teenagers, as if you have any teenager, you will know that they eat more. So I will say the portion size is very important, and this is a very good question as well, because some parents bring their children to me and they're like, they are not eating anything. I don't know what to do. And when we start going over the portion size, there are kind of like they expect that they will be eating like a plate like the adult size instead of like in a 5 years old. So they are trying to overfeed. Of course, they don't know about this. And so in terms of a portion size, the recommendation, it's not something exact. It has to be like this, but it's about, for example, 1 spoon of each food group per age until 4 years old. So let's say I have a 2 years old, it will be 2 spoons of grains, 2 spoons of protein, and 2 spoons of fruits and vegetables, each one, right? And so that will be for each meal. So breakfast, lunch, and dinner.
Okay.
Of course, a toddler will eat less and will need to eat more often because they have less space in their stomach.
Yeah.
So they will need to eat more often, like every 2-3 hours. But then when we are growing, our stomach also grows and we have more capacity. So we will need to eat like every 4 hours. If someone is more into physical activity, then it will be optimal to have some snacks in between.
Okay.
So depending on the amount of calories they are using, and also it will depend so much on how tall you are and how big you are and everything. So it will depend on each situation.
You mentioned a spoon, 2 spoons per year of a food group, right? Up until 4 years of age. But what size spoon? Teaspoon? Tablespoon?
It's a regular spoon, like a soup spoon.
Okay, like a server, like a regular eating spoon.
And this is just an approximate. It doesn't have to be like that. Some children eat more, and that's also important to let the children to feel their own cues. Sometimes we tend to overfeed the kids, and they insist like, I don't want to eat more, and we are like, you don't stand up until you finish your plate. That's not a good practice actually, because we are forcing that stomach to get bigger. So let the children kind of like explore how much, decide how much they want to eat from the plate.
That is good advice. And, I also am thinking, so we have these guidelines, these goals, but, for some kids, again, as we talked about with Amanda's kids, maybe some kids need a little bit more, a little bit less based on their activity level. I think about even my kids, I feel like because they're both little people, I don't even know, like, is that too much? Is that too little? So what are some things that parents can look out for in general to help identify if the diet is off, it's not enough, or it's not the right types of foods for our kids?
So luckily we have like 1 year checkup for our children. So I feel like Understanding well the growth chart, it's a very good way to see if they are getting the nutrients. If they're not growing, they're not thriving, definitely something, it can be malabsorption, or it can be like they're not eating enough nutrients. But in general, as a parent, you can look for signs as they are tired or they are constantly hungry. That will mean also that they're getting too much of those carbohydrate type of foods, right? Or it can be that sometimes they don't sleep well. They wake up in the middle of the night because they're hungry, especially babies. So it can be like dark circles under your eyes.
I think about, for example, even with my kids, sometimes I might not have realized that they were actually really hungry when they were really cranky too. So sometimes that can be a sign that they're hungry if they can't tell you that they're hungry.
Exactly.
And so thinking about that in my head, like, this might be it could be that they're tired, or it could be that they're hungry, and so I have to evaluate both.
And there is other signs, constipation, for example. It's a very good way to understand that it might be not getting enough hydration, and might not be getting enough fibers, so no fruits and vegetables.
Interesting.
And then the iron levels, of course, the labs that we can always check. But as a parent, like, those are signs that we can keep an eye on it.
Yeah, so looking at sort of those signs, and then of course keeping up with your pediatrician to make sure that they're growing on their growth curve appropriately.
Yeah,
that's great. So for those kids that might need more support, what can parents seek out, or what do we do for those families?
So here at Boston Children's, we have great multidisciplinary teams. Your primary care physician will direct you to these teams. It's prevention, and we can solve many of those areas, but sometimes we also need like a physician that will intervene with medication and will run the labs and etc. And also in the field of obesity, for example, we need mental health as well, because it's very important in this area. So multidisciplinary teams are a great source that we have here at Boston Children's, and depending on what area your children needs help.
No, I just love that approach, that you're sort of thinking about, the nutritional support, which may or may not be the primary focus, but it's the key piece. But then you also may have medical needs and a medical evaluation component to it. And then you may also have a mental health support. So sort of putting that triad together for kids that need that extra support is sounds really great to me.
Exactly. And sometimes we find out that children has a swallowing issue. So depending on the situation, you will find different teams with different specialists.
Yeah, so it's about figuring out what is really going on, and then coming up with the right plan of care. That's great. So Carolina, as we near the end, being here at Boston Children's with so much research going on, I always like to ask our experts, are there any particular activities going on from a research perspective in nutrition right now, or where do you see the future going?
Well, science always changing, right? So I have been very surprised to learn the relationship between Alzheimer's and nutrition. So all these high peaks of low sugar and crash down, it creates an inflammatory process in your body, and that process might also be doing something with Alzheimer's. It's not out there yet, but they're starting to think about that.
And that leads down the line to Alzheimer's.
Yeah.
Oh my goodness.
Yeah.
That's an incredible link. And again, it just kind of speaks to the importance of a healthy diet and how big a role nutrition plays in our overall health. So, Carolina, nutritionists are so important. I'm learning so much in all aspects of our health. For example, at Boston Children's, like where are nutritionists, and how are they working to help kids with their different overall healthcare needs?
We are literally everywhere. Every specialty usually has a nutritionist that will be the best care on that specific subject. We have great nutritionists here at Boston Children's, so I'm pretty sure if you need one, you will find the correct one.
Okay, so my final question before we end the podcast today is there anything that we haven't talked about yet that you would love our audience to be aware of?
Yeah, so I will say that having in consideration cultural preferences and traditions. It's very important, especially as a provider. I'm from a Latino population, and I will say 80% of my patients are Latino, and we speak Spanish. And even me as a Latino, I have to learn to understand, because I'm the South America and they're from Central America, so we have differences. So it's very interesting to really be open and really try to understand what are their cultures, because I don't want my patients to switch their cultures or their preferences, right? So I feel like that's very important, to try to incorporate all the flavors and all the things that people enjoy. At the end, eating, it's a pleasure, so we should enjoy eating, right?
I think that's really important to think about too. Yes, because I imagine that depending on your culture, there are different things that influence, your eating habits, and so how you can support families in that and thinking inclusively like that is really great.
Exactly, to give an advice that really the patient can put in practice.
It has to work for them.
Exactly.
You have to make that balance.
Exactly.
That's really great. Well, another question I wanted to ask too, thinking about different populations of kids, what about kids with medical complexities? And, I think about, for example, my kids, being little people having a skeletal dysplasia, and I think about my childhood growing up, my physician, my surgeon was always very cautious about, what I ate so that I didn't put on too much weight, because there was a propensity towards weight gain, but also because of my joint issues. Do you see kids in your work that have medical complexities, and how do you approach those patients?
Yeah, so I see a lot of those patients, and I would say like the line is kind of like the same. So it will be always to encourage proteins, fruits, vegetables, to being careful with the portion size of the carbohydrates, but also we will incorporate other needs, for example, some children with complexities of heart disease, then we focus more on sodium and kind of like also including more of these healthy fats on their diets, and we will switch depending on what the specific need is. But in general, I feel like we all need to eat healthy. And it's like this concept of the plate. I really like it, because it really covers that those are the nutrients that we need. So if you eat that type of food, you should be thriving.
Thinking about those concepts, they apply to everyone, but then there may be situations based on your medical needs that there's some unique advice that you give. That's really great. I'm already going to change the way I set up my plates. Instead of half of it being carbs, it's going to be half the vegetable.
Yeah, you can have a salad before, and then you can have like a smaller plate. Like we can work on it. We all can improve a little more our diet with little simple details. So
it's really amazing. Thank you for all that you do. You're helping all of us to stay healthy and happy.
Well, thank you so much.
Now on to doctor's orders. This is the part of the podcast where we prescribe an action that parents can take to help raise healthy kids. Carolina, what's your doctor's orders today?
Healthy eating, it's balance, it's portion size, it's learning to listen to your cue hungers. So I will say that one key message: don't force your children to eat. You as a parent are responsible of choosing what they are going to eat and at what time. And your responsibility, it's over. And then children has the responsibility, even when they have 1 year old, 6 month old, they're responsible to feel their hunger cues and to decide if they're going to eat and how much. So
we're in charge of what and when.
Exactly.
They're in charge of how much if they are hungry. Yeah. So letting our children listen to their body about what they need.
Exactly. And that will create healthy eaters throughout their lives. So it's kind of like a superpower that we're giving to our children.
I love that. The more we can give superpowers to our kids, the better. Thanks for listening to Boston Children's Answers. And a special thanks today to our parent, Amanda, and of course, our guest expert, nutritionist, Carolina. For more information, as always, you can check out the link to all the podcasts at bostonchildrens.org. Thank you again, and see you next time.